Hi, everyone. Thank you so much for joining us today. I will be introducing our speaker for today. Her name is Dr. Kate Sweeny. Professor Sweeny is, Professor Sweeny is a professor of psychology and a Teresa Byron Pollitt Endowed Term Chair of the University of California, Riverside. She received her PhD in social psychology at the University of Florida, where she initially developed her line of research on waiting and worry. She has now published nearly 100 papers on the psychology of uncertainty and related topics, and her work has been covered by the New York Times, the Washington Post, and NPR. After the presentation, we will have a Q&A session. If you have any questions throughout the presentation, please feel free to enter them into the chat window throughout the talk. Now, please welcome me in joining Dr. Kate Sweeny.
Hello, everyone. Let me get my slides up here. All right. Thank you so much for being here today or for watching this video if you're seeing it later. What I'll be doing today is just sharing some of the research insights from my last roughly 2 decades of research that might be sort of helpful or relevant during this period of very collective uncertainty that we're all experiencing during COVID-19. And then I'll also talk specifically about a study that we ran actually over a year ago now in China, actually in February last year, looking at well-being during quarantine in the context of COVID-19. So I'll wrap up with that study and then share a few insights from my research about best ways to cope with uncertainty, whether that's COVID-19 or other uncertainties in your life. So before I jump into some of the findings, because I'm going to be mostly talking at a pretty broad level about my research today, I at least wanted to start with some a general overview of the kinds of studies we've run that have led to the conclusions that I'll be presenting. If anyone has questions about the specifics of any of these studies, I'm very happy to go over those details or answer questions about them. Just throw those in the chat and I'll clarify anything you're interested in at the end. So one of the contexts in which I've studied uncertainty quite a bit is in professional and academic settings. Most professional settings involve periods of uncertainty, and pretty much all academic settings do, whether that's waiting to find out if you did well on an exam or a paper. We've looked at high stakes exams like the bar exam for becoming a lawyer in a given state, in this case in California. We've looked at people seeking jobs, particularly in the context of academic job market, and various other kinds of professional and academic uncertainties. We've also looked at political uncertainty, and this is actually, now I realize, one picture out of date. So we have done work on political uncertainty all the way back in 2010 with Prop 19 in California, which was a previous attempt to legalize recreational marijuana that did not pass at the time. And we've also looked at numerous elections. So now we've studied the experience of people awaiting the results of the 2016 and 2020 presidential elections in the US, as well as the 2018 midterm elections. And we've done a little bit of work looking at the experience of members of the Deferred Action for Childhood Arrivals program, the DACA program, and looking at their uncertainty, particularly during the previous presidential administration in the US over their residential status in the US. And then finally, I'm really interested in the context of healthcare, primarily because so much uncertainty in our lives occurs in the context of health. In many ways, that's where the greatest stakes are. And so we've done now a number of studies with women waiting for breast biopsy results. I won't talk about those findings today, but again, I'm happy to answer questions about them. It's an area of research I'm really excited about. We've done work on just general medical tests, and then, as we'll talk about today, now finally some work on COVID-19. So one of the things I want to mention right at the top is that many of the sorts of periods of uncertainty that I have studied in my career are unlike COVID-19 in a particular way, which is there is no obvious end in sight. When we study the experience of law school graduates waiting for their bar exam results, they know that on a particular day in November, their results will be online, they can go check them, and that will resolve their uncertainty. Same for people getting a biopsy, applying to jobs, at least to some extent, waiting for election results. a little more uncertain sometimes these days in terms of timing than usual, but generally speaking, you know that there's going to be sort of a clear and final resolution to your uncertainty at some point. With COVID-19, of course, it's not like that. We're all just kind of swimming in a sea of uncertainty and have been, at least in the US, for about a year now, almost exactly a year. And it's not entirely clear when all of the uncertainties of COVID-19 might resolve. But certainly, we do face many uncertainties in this context. And so I would argue that much of the research my lab has done does have relevance, even though the sort of weighting we're doing here is a bit different from the type we usually studied. To think about some of those uncertainties that we're facing, they are many. When can people go back to work, whether that means work in person or work at all for people who've lost their jobs? Interestingly, I put this talk together again about a year ago, a little less than a year ago. So this actually referred to 2020 summer, but it is equally applicable, it turns out, to the summer as well. People may have plans, maybe rescheduled plans for trips, weddings, various other big life events, and it's still quite uncertain when those might be safe. Of course, the scariest kind of uncertainty with a pandemic is whether a loved one will get sick, whether we ourselves will get sick, and of course, God forbid, whether we or a loved one will die of this virus. I should add a fifth bit of uncertainty here, and that now has to do with vaccines. I've been very, very fortunate to have both of my vaccines already because I'm an educator, but I suspect many of you listening have not had that opportunity yet. And that's, of course, a huge piece of uncertainty in terms of when will vaccines be available for everyone, how protective those vaccines will be, how that will change our ability to function, and so forth. So many, many types of uncertainty that we're facing here. And again, I think that my research can speak to why in the world that is so difficult. So that's really where I'll start here and just talk about a little bit of why waiting, or in general uncertainty, is so often so very, very stressful. One of the things that I have thought a lot about in the past decade or so is what is it about, again, uncertainty or waiting specifically, that is so challenging? I have myself said many times and heard many people say in my research and just in life that they would rather get bad news than continue to be uncertain, which seems kind of crazy, right? If you don't know yet what's going to happen, good news remains a possibility. Why would someone wish for bad news simply to resolve uncertainty? And I think it's because this sort of uncertainty that I study combines two really challenging psychological states: being uncertain about your future, so not knowing what's coming, and not being able to do much about it, not being in control. Each of those is challenging at a sort of existential level. It's not good for survival if we can't predict what's coming, can't control our future. And so when you combine these two into some kind of waiting period, like in the bottom left-hand quadrant there, we're dealing with a really psychologically challenging state of existence that is often temporary, but in a case like COVID-19 can stretch out for many months, even years. And so being in that state where you can't control and can't predict your future is inevitably almost going to cause quite a bit of at least psychological distress. We have in fact confirmed this when it comes to COVID-19, that people who feel very uncertain about their risk and feel that they have little control over their risk. This was early in the pandemic, so maybe that's not as prevalent now, but this certainly was true early on. Those are the folks who report being most distressed about COVID-19 as well. So those folks are squarely in that bottom left-hand quadrant. So I've mentioned psychological distress, emotional distress. If that's all we were dealing with, maybe someone could say, well, who really cares? Everyone suffers sometimes. Maybe that's not a big deal. I certainly don't feel that way, but I could imagine someone not thinking that was so important. But for those who might be skeptical about the importance of our emotional well-being, perhaps I can convince you that uncertainty is in fact damaging because it also affects our health. Indirectly, perhaps through something like stress pathways, where we have chronic elevated stress reactions in our bodies, and that deteriorates our health in various ways, or through something direct like loss of sleep. And in fact, this is what we have found in our research, is that people who are worried about some uncertain future outcome tend to report that they feel sicker, and they tend to report that they're sleeping worse. No big surprise, right? When we're uncertain about something, we often find ourselves laying awake at night, having a difficult time falling asleep or staying asleep because of those ruminative kind of constant thoughts we might be having about what our future holds. I'll also mention that in some very recent findings, we have not published these yet, we found that not only does quality of sleep seem to suffer during periods of uncertainty, But among our patients waiting for their biopsy results, we also found that people who were the most anxious during that week or so of the wait also reported much more variable sleep. So they weren't sleeping consistent lengths of time. They weren't sleeping consistently with the same quality. And so it seems that there are multiple ways in which sleep can be disrupted. And probably I don't have to tell you that sleep is super important for health and well-being. And then finally, in another kind of domain of health where waiting can come in and disrupt our lives, we've also now found that people's health behaviors might suffer a little bit during periods of uncertainty. So for example, we have found pretty consistently across lots of different kinds of waiting periods that people who are particularly worried report drinking perhaps more than is optimal, binge drinking, essentially, heavy drinking. And maybe this resonates, especially I feel like early during the pandemic, there were so many memes and Twitter discussions about the fact that many people were coping perhaps with the uncertainty and isolation by increasing their drinking. We have found this across many different types of uncertainty. Now, it's not great that waiting and uncertainty kind of challenges our emotional and physical health, but that might be okay if we're pretty good at getting a handle on it, if our coping strategies that we turn to during periods like this actually work. So do they work? We were interested in this question a number of years ago. And so what we did to study this question is among, in this case, law school graduates waiting for their bar exam result. Every few weeks during the waiting period, which is 4 long months, we bothered them with surveys asking them how they were coping with the wait and also how they were feeling in terms of their well-being and health. And we did this over and over throughout this 4-month waiting period. So excuse me, what we're essentially looking at here then is if someone says that they're using a particular coping strategy during 1 week, when we come back to them a few weeks later and ask how they're feeling, are they feeling better, seemingly as a result of having used that coping strategy? And when I talk about coping strategies, I'm talking about quite a broad set of ways that we might kind of tackle uncertainty at a psychological level. This includes planning ahead for the possibility of bad news, managing our expectations by bracing for the worst or hoping for the best, looking for the potential good in a bad outcome in advance, and then just trying to kind of take our mind off of our worry and also suppress or kind of squash down feelings of anxiety or worry. So there's a whole array of stuff we might do to try to cope. We were interested in whether any of those strategies seemed to work. And it's a simple answer, no, not especially. So we did not find any coping strategies that looked like they actually could kind of withstand the pressures of waiting, the worry that is almost inevitably present during periods of uncertainty like that. Now, I'm going to end our talk on a more positive note and talk about some of the strategies that my lab has been studying in the past 5 or so years to try to identify workarounds essentially to this problem that our coping system seems poorly equipped to deal with uncertainty. Again, fortunately, we have found some strategies that work. They may just not be the ones that are most automatic or intuitive to us. So they require a little bit of extra thought. Okay, there's lots of other insights I could share from my research, ways in which time gets distorted or our perception of time gets distorted while we're waiting, or various different aspects of health and well-being during waiting periods. But for the sake of time, I'm going to turn now to really our most kind of pertinent finding in terms of COVID-19. So let me just describe this study in a little bit of detail so you know the context of where these findings are coming from. So thanks to a colleague who had some connections with universities in China, this colleague, Weiwei Zhang, who's also a psychology professor at UC Riverside, he and I put together a survey last year in February when COVID-19 was raging in China, but as far as we knew, not yet in the US. Of course, we now know differently, but it certainly wasn't a topic of major conversation in the US at that time. And so we put together this survey in early February of last year, sent it out to his collaborators in China for translation and dissemination on social media. During this period of time, much of China was in some kind of lockdown, or at least some degree of restriction in terms of movement. And so we had to do the survey online. We did this survey over 2 weeks in February of last year. You can see that the mean age is pretty young. That has to do with the fact that A, it was social media that disseminated the survey, and B, we had connections primarily through universities, through these faculty members, and it's a little over half women. And then importantly, and I'll come back to this point, When we asked people at that time whether they were in quarantine, and if so, for how long, we found that about a third of the participants in the study said, yes, I am in quarantine right now as I'm filling this out. And most of those people said that they had been in quarantine for at least 2 weeks. Now that number might seem low, but let me remind you of a few things that, that may seem very distant history at this point. One is quarantine in China meant something quite different than what we're experiencing for the most part in the US. In many parts of China that were worst, that were most severely impacted by the virus, this meant you did not leave your house for anything, not groceries, not food, anything at all, or you would be arrested. So that was, a pretty severe form of quarantine. And we didn't have this term social distancing yet. That came after we ran our study. And so we had no kind of middle ground we could ask about. It was like, are you in quarantine, locked in your house or not? So that's why the number is a bit lower, because that was not true across all of China at the time. So you can see here the kinds of questions that we asked people. There was more than this, but this is the part I'll focus on today. We asked lots of questions about how they were feeling in terms of their emotional health, worry about COVID-19, loneliness, obviously from social isolation. We asked a little bit about their health behaviors, both healthy things and unhealthy things they might be doing. And then we focused in this particular survey on 2 experiences that we thought might be relevant to how people were coping with COVID-19 and quarantine. And those experiences were mindfulness and flow. And I'll spend just a moment here defining those in case those are unfamiliar terms. Flow, first, I'll start there. Flow is an experience of being completely in the zone, absorbed in some kind of really captivating activity. So this is the kind of thing that if you're about to have a meeting or leave the house, you cannot start this thing because you know you will just lose track of time. When we are in a flow state doing some kind of activity, we completely lose sense of ourselves, we lose sense of time, we are just completely in it with whatever activity we're doing. What these activities are is different for everyone. For me, it's analyzing data. That's probably not true of most people listening to this talk. You're probably not as much of a nerd as I am, but nonetheless, that's mine. And there are many other things that I do that create flow. Other people might find that experience in baking or gardening. Playing video games is a very common way of experiencing flow. There's lots of debate about whether things like watching TV or reading can create flow states, but essentially anything that you feel completely absorbed doing, the time just flies by, that is flow. We also then looked at mindfulness, which has a lot in common with flow. Mindfulness is basically an intense focus on the present moment, trying not to kind of let yourself be carried away by thoughts about the past or thoughts about the future or feelings that you're having in that moment or other thoughts you might be having, and really just trying to focus on exactly what you're experiencing right now. Flow and mindfulness have some things in common. They're both a form of focused attention, and they are both very much about what is going on in the present moment. But with flow, you essentially lose your awareness, your self-awareness, and with mindfulness, that's the target of attention, is your self-awareness, is your current experience. And so in that sense, they're pretty different. And we've seen in other research that both are helpful during periods of uncertainty, but maybe in different ways. So we were interested in comparing these 2 experiences during this period of uncertainty and, for some people, quarantine in China last year. Okay, with all of that preamble, let me get to some of the findings. So first of all, we were just interested in whether people who said they had experienced a lot of mindfulness in the past week or experienced a lot of flow in the past week, whether they were better off than those who hadn't. And like many, many other papers have found in many other contexts, that was in fact the case. So people who were more mindful reported better well-being on lots of measures, as did people who said they were experiencing more flow. Now, I would have been very shocked to find anything other than this. We know from about 50 years of flow research and thousands of years of mindfulness practice and perhaps 100 or more years of mindfulness study that these are good things. We know that they're good for well-being. So that was interesting, but not that interesting. More interesting to me was what happened when we looked at what seemed to be going on with those in quarantine. So first of all, you will not be shocked to hear that people who were in, as I mentioned, a pretty severe form of quarantine were worse off on, I think, every single measure of well-being and health behavior that we had. Again, not shocking compared to those who were not in quarantine. What was really interesting, though, is that flow, so experiencing a lot of flow in the past week, essentially broke this link between quarantine and poor well-being or ill-being, such that people who were experiencing a lot of flow didn't seem to matter for their well-being, whether they were in quarantine or not. They looked exactly the same either way. This was not true, interestingly, of mindfulness. So again, mindfulness was good for well-being overall, it seems like, but it didn't seem to have this effect of ameliorating the negative consequences of quarantine. And how this applies to our current situation, let's say in the US, where quarantine isn't really a concept that we face. It's more kind of varying degrees of social distancing. That's not entirely clear to me whether this fully applies, but I do think that based on these findings and other research from my lab, that if you are feeling like you're kind of jumping out of your skin, you are so tired of being in the same house day after day after day, that getting really engaged in some kind of activity that passes the time pleasantly, that captures your attention, that helps you sort of grow as a person and be challenged, that's a pretty good way to make this experience, this period of uncertainty, not quite as painful relative to zoning out, just kind of trying to check out and relax rather than engaging in this active way. So that would be my take-home message from, I guess, these findings, even though they're now a year, I don't say out of date, but they're certainly a year old. So as I said, I'm going to close this talk by sharing a few tips for better experience during various kinds of uncertainty, including COVID-19. I've already talked about flow and mindfulness. To me, as I said, these are both common in the sense that they have in common the sense that they are about directing your attention in a really intentional way. So not just kind of having your mind be all over the place, but focusing it on an activity or focusing it on the present moment, your experience, your breath. They have that in common, and they both seem to be helpful across many different kinds of periods of uncertainty, according to our research. A different approach, and one that we now have some evidence to support, is to seek silver linings even before you need them. What I mean by that is there's a lot of research in the world of kind of coping with stress and also bereavement and trauma that shows that looking for benefits, benefit finding, following some kind of trauma or negative event is really good for well-being. There are some exceptions to that, but by and large, looking for those silver linings, looking for that good in a bad outcome is a really healthy process following some kind of trauma. What we find is that that process doesn't have to wait until that trauma or that negative outcome occurs. People very readily seek these silver linings in advance to kind of prepare themselves for the possibility of bad news. Just as one example of a context in which we found how common this is, when we asked our breast biopsy patients, people who were there that day to get a breast biopsy to potentially diagnose breast cancer, we asked them this question. Can you imagine any good coming from it, any silver lining if you need to get treatment for cancer? And we found that over 70% of our participants, our patients, said, yeah, in fact, they could see some silver lining in a cancer diagnosis, one they did not have yet. And they were able to articulate a huge range of things that might come from it, being a role model for their children, appreciating their family more, being healthier in general. So it seems that even with something as scary as a cancer diagnosis, people are able to see those silver linings in advance. And we find in our research that that can be very helpful if that bad news comes, because you're already prepared with a kind of benefit or silver lining in advance. And that might make the impact of that bad news not quite so challenging, which is again what we find in several studies, which we are currently waiting for a decision on. We've sent that in to be reviewed, and we'll see if that gets published in the near future. So those are hot off the presses findings there. A very different way, all of these are kind of unique, but a very different way of buffering yourself from some of the challenges of uncertainty is to think about whether your psychological needs are being met. So this comes from a theory called self-determination theory that was developed by two very well-renowned social psychologists. And the theory is very complex, but what the core of the theory says is that we as humans have three fundamental psychological needs. And those are autonomy, being in control of your life and your various decisions and your actions, competence, being good at things you care about being good at, and relatedness or connection, being connected to other people. If those needs are not being sufficiently fulfilled, we suffer in terms of our well-being. And one of the things that I've observed in this period of COVID-19 is that it's really challenging for all three of those psychological needs. Our movements, our behavior is severely restricted. That's a threat to autonomy. Many of us are unable to do the kinds of activities that we might have found competence in before the pandemic for the same reason. And of course, the social isolation of social distancing has created, I suspect, a deficit in connectedness or relatedness for many people. So given that, it may be relevant that we find in our research that people who are more successful at meeting their psychological needs during a challenging period of uncertainty report not suffering quite as much from that uncertainty. So it seems like those needs can balance out the challenge that that uncertainty creates psychologically. So if you're feeling really stressed about COVID-19, maybe check in with those 3 psychological needs. If you identify a place where you're feeling a significant deficit, maybe look for kind of workarounds to feel more autonomy, to feel more competent, to connect with others, however you can do that safely. Another fairly recent finding with another collaborator from my department, Will Dunlop, is the benefit of imagining a positive future. Now, I have spent most of my career studying the benefit in negative things. I spent many years studying the benefits of pessimism. I think a lot about the benefits of worry as a motivator to kind of prepare and protect yourself from various potential negative outcomes. However, I must acknowledge that good things are good sometimes. And one of the things that I found in collaboration with Dr. Dunlop is that when people who are facing a period of uncertainty, in our studies, this meant waiting for a bar exam result or being a cancer survivor, which may seem very different, but are both types of uncertainty. In those contexts, we found that people who were better able, kind of more easily able to imagine a good outcome, passing the exam, remaining in remission from cancer, were better off in terms of well-being than those whose negative outcome came more readily and more easily to mind. Now, again, I am very committed to and aware of the benefits of bracing for the worst, for example, and how that can be a protective strategy to avoid disappointment, to avoid an unpleasant surprise. I do think that the take-home lesson from this finding that we published fairly recently is that it's you can do both. So you can both kind of acknowledge that there's a possibility that things will end poorly, that things will go poorly, and kind of grapple with that and prepare for that possibility, but while also allowing yourself to imagine a future in which things maybe do turn out okay, allowing yourself just a little glimmer maybe of hope, let's say, that we'll be back to something that looks a lot like normal in 6 months, for example. You don't want to get too attached to that optimism, but it can be really healthy to counteract some of the worry and the uncertainty that we're experiencing right now. Okay, and then last, another set of findings from our lab looking at emotions found that seeking experiences of awe, the sort of feeling of being small in the perspective of something much bigger than yourself, let's say really grand nature like giant sequoia trees or a mountain vista, or something like meeting your baby for the first time when the baby is born, all these sorts of experiences that create that feeling of like, wow, things are quite awesome around me. Those experiences, it turns out, are protective during periods of stressful uncertainty. And in our studies, we didn't actually, drag people to a national park or, make them have a baby. All we did was show them videos from, in this case, BBC's Planet Earth. And that was enough to actually boost positive emotions during a period of uncertainty and give people a little bit of relief from worry and stress during that period. So again, even if you can't or don't feel safe, going out in nature or seeking out kind of external experiences of awe, if you can just find maybe a nature documentary or a TV show that, through whatever pathway makes you feel awe, you might feel a little bit better during these uncertain times. So I will close with this quote that I think is very pertinent to our experiences these days and also to my research. This is a quote from Jon Kabat-Zinn, who is, I think of as kind of the modern father of essentially medical mindfulness. So he does a lot of work with pain patients using mindfulness as a way to combat their suffering. So in a book he wrote called Full Catastrophe Living, he said, "Patience is a form of wisdom. It demonstrates that we understand and accept the fact that sometimes things must unfold in their own time." And I think that's incredibly wise, excellent advice, and often much, much easier said than done. So as a result, our lab still has some work ahead of us. Thank you so much for your attention, and I'd be very glad to take questions if anyone wants to put them in the chat. I'll stop sharing my screen unless we need to get back to see a particular slide.
Thank you so much for your talk, Dr. Sweeny. We did have a couple of questions. So the first one, You mentioned some great coping strategies. Would you say that communicating with others about our stress would also help? If so, how
Yeah.
do we effectively communicate about others about this?
Yeah, that's a really great question. So, we've done so many studies over the years. I'm always struggling to decide what to put in a talk like this. We have studied social support as another route to some relief during periods of uncertainty. What I would say is that certainly talking to others, connecting with others is super important in every part of life, not just during difficult periods, and certainly especially during difficult periods. But the second part of that question is an insightful one. It's not easy to know how best to seek social support. There's a huge research literature, like many tens, if not hundreds of thousands of studies, looking at support and how we should support others and what kind of support seems to work best. But it's really complicated. So, for example, seeking support really actively, so like telling others, I need you right now, like I strongly recommend that as just a human, but I have to say in the research, oftentimes that sort of active solicitation of support can backfire a little bit and make people feel sort of needy or like a burden. And so actually what seems to work best is when people just support you without you really noticing it. So you don't kind of feel that sense of neediness or that sense of being a burden, and just get the support like invisibly. We call that invisible support. So all that is to say that I think that one of the things that the research has shown most compellingly is that if you are someone who is supporting a person facing a lot of uncertainty, the best thing you can do is essentially shut up and listen, and try to hear what they need. And there's no universal right answer. Some people want advice, some people don't. Some people want you to tell them to be optimistic and that everything will be okay. That would be super annoying to some other people. Maybe some people want you to game out worst scenarios, worst case scenarios, others that might be really depressing. And so it's not an easy job to be a supporter during a period like this, but it's most effective if you kind of pay attention or even ask explicitly what kind of support the person wants or needs, and then do your best to provide that support and not like just do whatever you think is best. And the question of how to talk to people, I think doing it is always better than not doing it in terms of that connection piece. We just know that social support is so important for well-being and health. And so I think any way you can make yourself reach out to others, especially during this time, is a good thing, whatever that looks like.
Awesome. Thank you so much for that answer. We do have one more question, and that's if I am feeling stressed and I can't fall asleep, is there anything I can do?
Great question. It's a question that has been lucratively answered by a number of companies because sleep is so elusive, especially during periods of stress. And so you can find lots of apps that at least claim to help you sleep. There's no, universal solution. And boy, if I had it, I would tell you, because I also struggle often with not being able to fall asleep easily. I don't know what it is, but I find that one's mind is just dark and cruel oftentimes in the late hours of the night. And so it really can become, a challenge once you start kind of thinking about all the worries in the world, and that makes sleep even more elusive. One thing that I have found that works for me, and that many other researchers have found, is that mindfulness is really good for sleep. And there are different ways you can kind of apply that. So it is the case that if you practice mindfulness, and that doesn't have to be like a 2-week-long silent retreat, that can just look like 5 minutes a day, 5 minutes every few days. Any amount of mindfulness practice seems to be really helpful for reducing stress. And the more you practice mindfulness, the quieter your mind becomes. I can tell you I was skeptical of this. I sort of felt like it was like a hippy-dippy idea, 5 or 10 years ago when I first started reading about mindfulness. And I've just been completely convinced that the research is there. It really does suggest that you can train your brain to be quieter, to not sort of loop thoughts constantly, to not be constantly thinking about that silly thing you said yesterday or that challenging thing you have to do tomorrow. So practicing that will quiet your mind throughout your day, throughout your night, and make it easier to sleep. But even if you haven't, had a nice mindfulness practice for weeks or months or years, there are lots of meditations that are actually sort of designed to wind your brain down. And you can find those again through free apps, through YouTube and so forth. And so I turn to that as my suggestion because I don't know of a lot of other well-established non-pharmaceutical options, but that is one that is free and easy and probably at very least harmless. And so if it works, then great, you've maybe found a solution that can help maybe shorten that period of laying stressed out in the dark. So that's my one suggestion, and boy, I will publish it quickly if I find any others.
Thank you so much. Well, everyone, you heard from Dr. Sweeny. Mindfulness is really useful. We actually had a talk about mindfulness a couple of months ago. So if you'd like to learn more, you can check out our YouTube channel and you can learn more about it there. Well, thank you so much, Dr. Sweeny. That concludes our Q&A session. Have a good day, everyone. We have a talk every Wednesday each month at 2 p.m. So if you'd like to learn more about these topics, you're welcome to find out about it in our website. You can also scan this QR code to learn more about it and sign up for future talks.